Today we're going to demonstrate our new technique for biceps tendon transfer with rotator cuff repair. This is a patient with a chronic rotator cuff tear, atrophy on MRI. We were going to attempt to do some sort of repair, but also want to transfer the biceps for newer and better tissue and to add support. There's been good data for this. You can see it's fairly retracted, slightly atrophied. There's 2 layers here. We're able to get it enough back to the margin, so we're going to use the biceps as reinforcement and center it, essentially using this as a superior capsular reconstruction. We're going to place an anchor. This is a knotless mechanism as well as a fiber tape. We're going to pass this around, we'll link it up, and we're going to pull the biceps so it's centered and keeping the humeral head depressed. And we're going to further cinch this locking mechanism down, and then we're going to remove this, and then we're going to take the fiber tape, pass it through, and we'll tie this. This will keep the biceps in line and help with the humeral head suppression. There's been a number of studies showing that this is a good technique for these situations. And then we'll place a second fiber tack more laterally. Following this, we're going to start the rotator cuff repair. We're going to repair the posterior aspect first. We're going to pass the stay stitches in a Mason-Allen formation, and in the middle place the fiber tape, and we'll sequentially tie these stay stitches to help make a rip stop. And data has demonstrated this has decreased chance of type 2 tears of the rotator cuff. And again, here we already have the reinforcement of the biceps. This will be a secondary fixation. We're going to place the anterior anchor. This is not only going to help with fixation of the rotator cuff, but it will keep the biceps in line. And now you can see we're going to pass these sutures again in a similar mattress fashion. We'll pass the stay sutures on either side, and in the center we've passed the tape. And then we're going to sequentially tie them. The shoulder is elevated up to allow us to get maximum tension of the rotator cuff. We'll cut these stay sutures, and they help give us traction and compression of the rotator cuff. You can see here we're sequentially tying now the front, and we'll cut this as well. And then we'll take the tapes from either side for a speed bridge construct, and we're now lateral. Again, all of these lateral anchors here are going to help hold the biceps in line as well, so it stays centered, it adds collagen and further support. We're going to add both lateral rows. You can see here now we've done crisscross double row fixation, the biceps in the middle. There are at least 4 anchors, 2 on each side to hold the biceps in, as well as to compress the rotator cuff. Thank you.